Good afternoon. Kindly allow us to start the fourth and last session, and I would like to apologize for coming late for other arrangements or other engagements. But what I have witnessed so far shows great keenness and commitment by different parties who have extensive expertise and who are willing to put the resources, time, money, and effort. It's really encouraging. I'd like to thank the ECES and Dr. Abla for their support, which makes the ECS evolve from the traditional think tank image to a more dynamic body and an agency that is more into application on reality. Particularly for SMEs. This last session is about competition that was partly finished, and then a bigger competition is in the pipeline for the October conference. It is important because competitions are not only about the winners, rather they create an ambience for all the players who prepared, who worked, or maybe who hesitated at the last moment. But this environment that's created by any fair competition is enriching. It is also my pleasure because as far as I understand, because most of the people come from governorates, most of the time I spend in Asyut, and I have real conviction that the treasure of talents that are looking for open windows exist in different governorates, not only in Upper Egypt. That's why today's efforts are very important. And for all who are following today's seminar, we have the evidence that to change the society, you do not need major resources. Rather, you need keenness and sincerity, sincere efforts. I would like to call on Dr. Abla to talk about the award. Thank you, Dr. Ziad. In the last session, it has been mentioned that the Africa exhibitions or conference is going to be held in October, including African entrepreneurs, but more importantly, Egyptian entrepreneurs. For us to select them, the ECES is going to hold 4 months activity starting from Jan up until April. The competition is going to cover Egypt starting from Sohag, Ina, Luxor, Aswan, the second region, Fayoum, Asyut, Red Sea, New Valley, and the third one, Damietta, Sharqiya, Port Said, Suez, North and South Sinai, Bahira, Giza, Cairo. We did not follow the urban and rural lines for their distribution. These are the 4 regions. The applicants should not exceed the age of 40, and they would apply through an idea that has an added value, whether for a product, a service, or otherwise, something that has to do with agriculture, industry, manufacturing, or AI or the applications of information technology. And by added value, I mean the addition of the economic impact, something that's cost effective. We left it open in order to allow for more opportunities. This is going to be uploaded on our website within 1 month tops. The applicants are going to send the project expressed in 200 words, and there is a screening process that's going to sieve the best 20 suggestions for small businesses that do not exceed 3 years. And a conference is going to be held in one of these regions. The choice of the regions, for example, for Upper Egypt, we're going to Sohag. We're going to the less trodden governorates. We went to Asyut along with Dr. Khaled and Dr. Ziad and Mr. Sharif Sami, who was here in our midst this morning. And that day, on our visit, we're going to talk about the ecosystem, the available ecosystem, to gather people from the CBE, from the Mismeda, and any party involved. We're going to listen to their presentation, and a jury will be able to decide so that we can manage to get the best three in terms of idea and project in all of the categories. There will be certificates of recognitions and awards. These groups are going to be invited to the October conference. They are going to represent Egypt. This does not mean that the rest are not coming. Everyone can attend, they can register, but these people are going to be adopted with full support. So I wanted to let you know, and in order to start this endeavor, we started a competition, and after closer examination, we found that we're going to look for the up and running businesses. We're going to give them an idea to present, to listen to them, and we have the jurors, and then we're going to give the certificates of recognition. Thank you. I'm not one of the jurors, by the way. Allow me to call on the presenters. The first one's called Consolto. Kindly, you have 10 minutes for your presentation. My name is Rami. I'm a founder at Consolto. I would like to thank Dr. Abla and this informative day. It's really good to know that people are aware of the challenges for entrepreneurs. A very brief introduction regarding Consolto. We are a medical startup company. We do not work in technology. Technology is a vital part of the service, but it is not the main idea. We provide medical service with a new concept, which is multidisciplinary treatment. This idea could be explained further by Dr. Sameh. I'm not a physician. We offer new solutions for the challenges met by the medical sector in Egypt, including the contradictory opinions. Patients could receive contradictory opinions by two different doctors. Also, it takes people a long time to get an appointment, and we're talking about complex cases. So these people suffer from confusion. We want to be a high quality medical consultation service, and through our physicians who have international experience, this is a new idea in Egypt and the Middle East, but it is applied in all the advanced world countries. When you have complex cases such as involving a serious illness such as cancer, it's not only one person who takes the decision, which usually require a group of doctors to decide the case and decide on a plan. We have a local team, and I'm going to turn over to Dr. Samah to talk about the multidisciplinary treatment, because it is more technical. Thank you. Rami, who started, this started in 1995 in Britain. These are the most influential people in the development of the cancer service in Britain. He is a Scottish surgeon, and she is a physician from Wales, and you can see the impact of the cancer treatment results, because in this region the cancer treatment rates were lower. The Kalmanheim report is a very complex and detailed one, but it includes two important concepts. First, it provides the medical services by a specialist and not by a generalist, meaning that you have a general surgeon and another one that works, for example, on colons. Specifically, this concept progresses or improves the performance. And you can see up until 2015, you will find a lot of evidence found proving that despite the high cost, the NHS in Britain has a budget of 129 billions of pounds in Britain. The Consolto is an added value in terms of providing services that are not available here in Egypt or the Middle East. It is usually done individually, but there is not a governing system in place that groups 4 or 3 doctors together and gives you an opportunity to discuss your treatment. Consulto abroad is a little bit different. If a patient wants to meet with a doctor from abroad, we provide the video conferencing services so that they can meet with a doctor from a respectable hospital, and by the end they get a report that's signed by same doctor and by the team that are going to support the treatment plan that was devised, which saves a lot of money and the travel. These are the different fields, different teams that we work across. They are very complex: gastrointestinal, endocrinology. All of these specializations need consultation. The pathway for this project is really easy. The patient contacts the center, and they get their whole profile, set the time or appointment for the first visit, in which the doctor decides whether consultation is needed or not. If they do not need it, then they could provide the treatment. But if the case requires consulto or consultation, appointment is set 1 week later, during which the team discusses the details, and then the patient gets to meet with the whole consulto team to discuss the case. We stop at the diagnosis and treatment plan, but we do not go into, so far we do not go into treatment. This is going to be part of our expansion, that we can also include the treatment point. So far we give the consultation and the report. This gives the doctors, if they join Consolto, and this is what we're seeking to do, we are also working on setting the criteria for selection. Many doctors are approaching us, but there is a filtering process in place. The founding physicians have international expertise. They worked abroad. They have witnessed firsthand how the system works in large hospitals. And